Anxiety is one of the most common mental health challenges that people struggle with, and if you find that you are a bit more of a worrier, as in you worry about many different things, rather than a warrior, as in like the Spartans, then I think this video is going to be for you, because I'm going to talk about the complete guide that I use with patients when it comes to cognitive behavioral therapy and other evidence-based strategies to make a person go from a worrier into a warrior. Hi, if you don't know me, my name is Dr. Parky Lau. I'm a clinical psychologist licensed in the state of California, as well as the province of Ontario, and I've been studying and practicing evidence-based mental health strategies for the better part of a decade, and I'd love to share some of that information with you. So let's start by understanding what is Generalized Anxiety Disorder, otherwise known as GAD. So the fundamental component of GAD is an excessive worry. People with Generalized Anxiety Disorder tend to worry about everything all the time. It could be about finances, friends, it could be about romantic relationship, health, the future. There's just worry constantly going on, and it feels very out of control and excessive compared to what a sort of quote-unquote regular person might be worrying about the same thing. So the person with Generalized Anxiety Disorder might worry on about missing a potential appointment the next day, whereas another person might say, okay, like that's something I might want to consider. Maybe I'll set an alarm 30 minutes before, and then it's out of their mind. So to be diagnosed with Generalized Anxiety Disorder, the worries have to exist for at least 6 months or more, and it usually takes up quite a bit of a person's day. So oftentimes a person with GAD will say something like, yeah, I worry kind of all the time, it takes up at least hours of my day, and it's really hard to kind of shut off my mind. So you can kind of sense of the chronicity in terms of like how long this worry has been happening, as well as even on a day-to-day, the pervasiveness of these worries. And these periods of worry are also paired with certain physical or other types of symptoms, like a sense of feeling restless, on edge, feeling tired or irritable, difficulty sleeping or difficulty concentrating, or just feeling a lot of tension and tightness in their muscles. So now that we understand how GAD is maintained, we need to also figure out what are the mechanisms or the reasons why GAD is maintained. And I think this is important from a theoretical or foundational perspective because we need to understand the why to get to the how. Like we can't just talk about strategies that we're going to use when we don't understand the sort of why and how GAD is maintained in the first place. So now I'm going to talk about 3 kind of factors that really play a big role in how GAD is maintained. So the first maintaining factors is something called intolerance of uncertainty. So people with GAD tend to have almost like this allergic reaction to uncertainty. They kind of say to themselves, I'd honestly rather know I got the bad news, like I didn't get into that sort of college or I didn't get the job, than to stew in this anxiety or this uncertainty any longer. So you can kind of hear there that uncertainty is almost worse than the worst case scenario itself. And this is one reason why people with GAD tend to worry about anything and everything, because a lot of the world is uncertain. We don't know what's going to happen the next year, the next day, or even the next second. I could be struck by lightning right now. And because the world is so filled with uncertainty, a person with GAD tends to feel very worried as a result. And a third maintaining factor of GAD is a strong fight or flight response. A person with GAD tends to constantly feel like their smoke alarm is ringing, and it's hard for them to be able to disengage from this sympathetic nervous system response where our heart rate is elevated, always feels like there's danger around, we're kind of always prepared to fight or flight, and as a result, it makes it hard for them to actually tone down that smoke signal to actually feel more managed and feel like they're in a calmer state. Okay, so now that we've talked a little bit about the maintaining factors of GAD, now let's go into some of the evidence-based strategies that I often use with patients to really see actually quite a helpful and in some ways profound benefit in breaking this sort of perpetuating factors, these things that maintain anxiety. So the first strategy that I'll talk about is something called the behavioral experiment. So oftentimes when people are faced with uncertain situation, their mind goes towards the negative. If I were to try out a new restaurant, I'm not gonna like it. If I go watch that movie, that's gonna suck. Or if I ask that person out, they're gonna say no. And as you can imagine, like all these more uncertain, ambiguous situations, people take a more negative bent towards them. But in reality, we kind of just lived a hypothetical scenario in our minds. We don't actually know if that person will say no, or if we're not gonna enjoy that new food. We just assume that and we say, okay, well, my brain said, that's not going to work out, so I might as well just not do the thing. And this consistent avoidance of uncertain situation actually maintains our anxiety in the long run because we constantly think to ourselves that we've avoided a potentially dangerous scenario, so that's a good thing, and I honestly probably couldn't have handled it if it was a negative situation. So you can kind of see that the lessons learned from this avoidance behavior sneakily kind of maintain our fear of uncertainty. And the behavioral experiment basically says, wait a minute, like I lived this hypothetical scenario in my mind, but I really actually have no idea of how things will come out. Like if I were to actually watch that new movie, or if I were to actually try that new food or ask that person out, I don't actually know what's going to happen. So maybe what I can do is to test my prediction, my brain's anxious prediction, just to see if it's true or not. So fundamentally, a behavioral experiment is super simple. You say, oh, like my brain's made a prediction about an ambiguous or uncertain situation. Why don't I just test it out? Be a curious scientist and see what would happen if I were to do the thing anyway. So some examples of behavioral experiments could be trying out a food from a new restaurant, going to the movie theater by yourself, or, trying out a new bubble tea flavor. It can be as low stakes or high stakes as you would like it. And I think the great thing about a behavioral experiment, the secret is that it's really a win-win. We either learn that uncertainty is not always synonymous with bad, like it can sometimes actually turn out really awesome. Maybe now you found a cuisine that you really, really love. Or it could be neutral, where it was like, it wasn't too bad one way or the other. Or even if it is negative, that we learn sort of our own resilience to bad situations. We say, oh, like, yeah, it wasn't so great, but that's okay. I can just try a different food next time. Or yeah, that person said no and that kind of sucked and that was lame, but that actually helped me kind of build up a bit more resilience to maybe asking the next person out. So all of those things kind of allow us to see that a behavioral experiment can either change our relationship with uncertainty. That uncertainty doesn't mean bad. It just means that we don't know what's going to happen. And number two, even when an ambiguous or uncertain situation ends up poorly, we learn that we survive. Okay, so now let's talk a little bit about other ways that we can handle worries. So first of all, I want to distinguish between more productive types of worries and more hypothetical types of worries. So productive worries are the worries that are kind of things that we might need to resolve in the near future, and they're pretty likely to happen. Like for example, a classic one would be, let's say you need to get childcare because you and your spouse are going on a nice trip together. So in that way, this is kind of a very productive worry because there's something that needs to be done. You gotta get some sort of childcare for your kid. So in that context, this is a very productive worry that needs to be solved. On the other hand, there are these hypothetical worries that happen where we kind of think to ourselves, well, what if 10 years down the road I get sick and I can't work anymore? Or what if at some point I get fired from my job? You can see here that there may not necessarily be a problem to be solved in that very moment. It's just something that comes up. It may or may not happen. We don't really know. And in that case, there's not really a problem to be solved, at least in that moment. And the reason why I distinguish between productive and hypothetical worries is that what we do and how we navigate the situation depends on the type of worry that is presented. So for example, for a productive worry, I might move into more problem-solving focus mode. So in this context, well, I need to get childcare, so what can I do? Maybe I can call my parents, I can call my in-laws, I could check a daycare center to see if they have any availabilities. So in that context, I'm just trying to resolve the problem. On the other hand, for hypothetical worries, you can see how the problem-solving approach may not be particularly useful because we're dealing with something that we don't really even know is going to happen, or if there's anything we can do about it. Like we might be worried that at some point our country might explode, and there's nothing we can really do in that very moment to actually resolve anything. Another strategy that can be really helpful, and you might be pretty aware of this one, is something called relaxation exercises. So relaxation exercises are intentionally designed to take us from a sort of fight or flight response back to a calmer baseline. So often all the things that we do as part of relaxation are kind of opposite to how we feel when we're in a fight or flight response. Like our usual breathing might be super fast and shallow when we're anxious, but deep breathing exercises intentionally get more air into our diaphragm. It intentionally slows our breathing, or ways to kind of like sit and meditate, ways that we can bring ourselves into a sort of quieter, calmer space. And there's a number of different relaxation strategies. This is kind of a choose your own adventure. Some of the ones I often use with patients include box breathing, where we breathe in for 4 counts, hold for 4 counts, breathe out for 4 counts, hold for 4 counts, and then kind of repeat until you're kind of feeling more and more comfortable. Another strategy could be more like guided visual imagery, where you might kind of listen and bring yourself into a very safe space, like a beach, or a safe house, or a little haven for yourself. Or it could be more like progressive muscle relaxation, where we intentionally tighten and then loosen parts of our body to bring our body into a more relaxed state. And in terms of these exercises, there's like a million of them on YouTube. I also have a couple on my channel if you're interested. And any of those strategies practiced regularly can be a great way to reduce basal arousal and generally get you out of the fight or flight response. And alongside these relaxation strategies, one final technique I'll offer is something called mindfulness practice, where mindfulness practice is not like relaxation exercise where we're trying to like calm ourselves, but rather it's about sitting with different experiences in a non-judgmental way. So oftentimes, for example, when we have a worry, we kind of like put a lot of importance and salience into that worry. We say, oh my gosh, like I had that thought, what if it does happen? And we kind of follow that thought until we start to feel like we're in a bit of a panic. And mindfulness says, hey, like we can have these experiences, but we don't actually have to engage with them. We can just say, hey, I'm having some worries right now, or hey, like I'm noticing these physical sensations that are of anxiety, feels a little bit uncomfortable. Is there a way I can just sit with them and allow for some compassion, maybe breathe into them a little bit without actually engaging with them? And by engaging with these kind of experiences in a bit more of a distance way, the sort of these physical sensations, these thoughts and emotions, they begin to lose power on us. Instead of like we have these thoughts and therefore like we have to act, or we have these physical sensation and we have to kind of like do something about them, mindfulness gives us a different way to relate to these experiences so that they don't have as much of an impact on our general well-being. So it's almost like, we used to feel fused with a thought or a physical sensation. Mindfulness says, can we just observe these? And you're over here and the experience is over here. So I've given you a few different strategies that you can use to start improving on the anxiety piece. Now the question becomes like, how do I take what I've learned here and apply it into my life? So you might first of all think about, what are the strategies that resonated most with you? Was it helpful to understand the difference between productive or hypothetical worries, in which case it might be helpful to then use maybe some problem solving and worry journaling? Did the idea of being allergic to uncertainty or intolerance of uncertainty kind of feel like it resonated with you a lot, in which case maybe a behavioral experiment could be really useful. So really identifying what are the things that could be helpful based off the way that you sort of conceptualize your own issues with anxiety, and then picking the right tool to give a shot as an experiment. And you might think, well, I don't know if it's something is going to work, and you could be right, you could be wrong. So you can even treat trying these strategies as a bit of an experiment to see if it offers you any improvements in how you feel. And if you're still feeling a little bit stuck, I would just say to start with some behavioral experiments. I find that in terms of the bread and butter of treating generalized anxiety, behavioral experiments are awesome and they generally benefit most people. So whether it's something very, very low stakes, like trying a new bubble tea flavor or trying out a new restaurant, to something a little bit more high stakes, like maybe instead of preparing 30 minutes before going to an appointment, you just prepare 5 minutes before, or you don't set 20 alarms, you just set 1 or 2 alarms. All of those things can be ways for us to, in some ways, target some of the implicit negative predictions that we have about engaging in these types of behaviors to increase certainty, and actually just jump into uncertainty to see, number one, whether it is actually going to be negative, and number two, even if it is, are you going to be able to sink or swim? And remember, just like with everything else, these skills take time and practice and consistency to really see the benefits of them. It's kind of like you're working out a muscle. You're not just going to do a few bicep curls and all of a sudden have giant guns. You're going to require a little bit of extra practice throughout the days, and then also sort of progressively overload, maybe starting with some low stake situation or a very small mindfulness or relaxation practice, and then being sort of building on that and becoming more and more consistent, getting to the higher stake situations, maybe building up a little bit more of a consistent routine for relaxation exercises, and then you'll get there. So hopefully this video was helpful for you to learn a little bit more about some of the evidence-based strategies that I often use with patients to support their anxiety and help you to turn from a worrier into a warrior. Thanks for watching, and I'll see you in the next one. Bye-bye.